Hey guys, welcome back to Contest Prep University. I'm Joe Klemczewski with Adam Atkinson. We're going to wrap up this series on PEDs for males, just with some medical management advice, or at least considerations to look into. And I almost think, Adam, this may be something we do come back to in the future to really give some detail, because as I mentioned a few episodes ago, more than anything, you have shown me exactly how little I know about this topic. And I'm sure there are other people in the same boat. But my question to you is, you've talked about getting labs and making sure you're staying healthy and using minimum effective doses. Are there physicians, if our viewers out there went to their family doctor and said, hey, I want to do this, can you help me? Are there family doctors, primary care physicians who would say, sure, that's within my scope of ethical practice? Or are they like, what the fuck are you talking about? Of course not. That's a Scheduled I substance. Get out of my office. Where do people go?
They are here to help you, so you can go to your doctor, but they might not be knowledgeable. I think an endocrinologist is one of the best places you can go for this stuff. However, there's also hormone clinics out there. The bad thing is these places are not created equal by any means. Just if you guys were listening to our prior episode about what a normal baseline level of tests might be for a guy. I had a girl prescribed a male dosage of testosterone at one of these clinics because they just simply didn't know what they were doing. And it's
Was it kind of an anti-aging hormone replacement type clinic?
Yeah, you got it. So a lot of these places are just kind of there to write a prescription, so to speak. But you should be able to find somebody pretty reputable. I know one of the really popular clinics actually sponsors a lot of the bodybuilding shows, the Olympia. So if you look at like some of the medical centers that like sponsor the Olympia, that's kind of a good segue to start on getting some good professional help. However, you pay for it, it's expensive. And I think that, you can't really put a price on your health, though, to work with a professional that will, really monitor your health, maybe even potentially have you get the additional tests you might need based on your genetic history, like an NMR lipid profile is a really good way to look at the particle size of your cholesterol, see how much of it's oxidized and like sticking to the arterial wall. So there's a whole like slew of tests you can get. Especially, I want to say too, we're kind of being a little bit harder on the men in this podcast, but you guys have to take so much more than the women in terms of dosage. It really is harder from the health component to, manage. So that's a point I want to drive home with that too. That I'm not being hard on you guys, but it's a more serious I think it's a more serious consideration with men in terms of long-term health. With women, it's a little bit easier to manage.
Yeah, that's a really good point. And I'm wondering, because I can see probably most people saying, wow, I don't even want to risk that conversation with a physician. Can't I just do this on my own? Can't I go to a lab or send in some blood tests or something? And because there are a lot of places who do that. There are, I don't know, it's LabCorp or other people. Gosh, what's that one out of Texas? They were actually on Shark Tank that
Was it Quest or
no, there's one that where specifically just for anything you're trying to manage, there is a direct to consumer kit. They have a kit for everything. You can check your cholesterol, you can check your testosterone, you can even check for
Everly
STD.
Well?
Yes, that's it.
Yep. Yeah.
What was the name again?
I think it's Everly Well.
Everly Well. Right. So is there a way, do you think, for people to be a little bit DIY in terms of trying to manage some risk?
Yeah, I mean, you could definitely work with somebody like me and I'll help you with that. I'm obviously not a medical doctor though, so I always like to drive that point home. But, I do want to make sure people, are getting the right tests done and looking at things to, hopefully have a bigger conversation with their doctor or get the labs. We go over them, but still send them to your doctor. You might be due for a colonoscopy. And if you haven't seen your doctor in 5 years, they might not be the type of doctor that reaches out to you and says, hey, you need to get this done. So you're better off being seen by your doctor about twice a year, and just make sure you pick a doctor that you align with well, that will accept, what you're doing. And I think a lot of people forget, people go to the doctor because they drink too much and they have elevated liver enzymes. They're here to help you for longevity and not push you out of their office. So hopefully they'll give you a referral if they don't feel comfortable with it.
Yeah, awesome, Adam. So I really appreciate some of the balance you brought to this conversation and the scope. And for our audience, our next series is going to be a little bit more general. We did a series for women, a series for men, and now we're going to talk about some of the more collective things we haven't discussed yet. Some of the things like clenbuterol, T3, and so forth, and just considerations in general. And I'm going to propose something to you on the spot here, Adam. I wonder if there is a client or somebody who has a lot of experience that we could even interview for maybe a fourth series, or at least maybe just a longer feature. We'll sit down for 30, 60 minutes and go through somebody's actual experience with this. Because, I certainly don't have the information. And as you said, neither one of us are medical professionals, not physicians. And so I think that may be something we hit up here in the very near future.
Yeah, if anyone wanted to jump on, we'd love to have you. Also, I'm sure we could find somebody to jump on, like maybe a bodybuilder that wants to speak.
Yeah, I'll see what Dorian Yates is doing or something like that.
I like it.
All right, guys. Thanks so much, Adam. Again, you're awesome. We will see you next time in Contest Prep University.